My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Welcome everyone to today's virtual town hall at Hamilton Health Sciences, today being Thursday, March 11th. We have a packed agenda today, and I think we'll kick things off with a bit of a remarking upon particularly the passage of time since the WHO has called a pandemic, and I'd like to invite our President and CEO Rob McIsaac to kick things off in remarking on that particular event. So Rob, over to you.
Yeah, thanks very much, Aaron, and thanks everybody, as always, for being here today. As Aaron said, we've got lots of ground to cover, and I'm sure you've probably got some questions for us at the end, so we'll do that as we always do. In addition to the regular updates about our operations, the ongoing transmission of the virus and variants of concern, vaccine distribution, and specifically the changing recommendations regarding dosing intervals, maybe I'll start today by taking some time to reflect on the last year. The Government of Canada has recognized today as a National Day of Observance, marking 1 year since the pandemic was declared by the World Health Organization. You know, COVID has demanded a lot from each one of us, both people at work and at home. We've experienced loss and change in varying degrees, but without a doubt, I think COVID has impacted all of us. We've changed how we do our work, we've changed how we go about our daily lives, and we've changed how we interact with each other. I'm optimistic we are going to start to see some system recovery in the coming weeks and months. But for now, it's important that we take some time to pause and acknowledge that this has been such an extraordinary year, a year like no other. The pandemic has brought with it numerous firsts at HHS in our community and beyond. Each of these milestones have required us to think and act in ways that stretched our resilience and often tested our teams. And while none of us would have wished for a pandemic, there have been some extraordinary outcomes. I'm super proud of our team. It's been really remarkable to witness the pace at which everybody responded to the many challenges of the pandemic. You responded swiftly to adapt to evolving policies and processes to keep our patients and each other safe. You implemented new ways of caring that ensured we could stay in touch with our patients and meet their most urgent healthcare needs. And you continue on a day-to-day basis to provide exemplary care, whether it be in our emergency departments, our intensive care units, our COVID units, and of course, throughout the whole of HHS. And not only did our team come together to meet this challenge head on, but we also collaborated with numerous other partners, locally, regionally, provincially, nationally, to manage and contain the virus. Over the coming weeks, you're going to see and hear more about this 1 year milestone. And I think it will mean something different to every one of us. For those that would like to take the time to pause and really reflect today, I'd like to remind you about a special webinar taking place at 4:30. The webinar has been organized by Dr. Andrea Frolick, Director of the Program for Ethics and Care Ecologies at HHS, and details have been included in the Daily Dispatch. We'll further acknowledge the moments and activities that have marked the pandemic through storytelling and other activities in the coming weeks. Once again, I just want to say how enormously grateful to each of you I am for all of your contributions and ongoing efforts in getting through this past year. I know that as we begin to recover from the intensity of the past year, and we're not totally out of the woods, but I do think we will start to see some recovery in the relatively short term. But the journey will be kind of different for each of us. So I would just say be kind to yourselves, continue to be kind to one another. And I encourage you to connect with your leader and colleagues and access the resources we have available on our website to help better recover moving forward. So again, the agenda for today will start off with the usual operational update, move on with an epidemiological update, let you know what's happening with the vaccine. Then we'll move into, as always, Q&A and celebrations. So with all of that, I will turn it over to you, Aaron.
Thanks, Rob, and thanks for those remarks. We have decided to do a poll again today. We've done this the last two of these webinars, and it's helped, I think, to get some information about who's participating on the line. We thought it would be most useful to do that over the course of a month at minimum to try and get a sense of who's attending from various different areas of specialty in the organization and as well from different sites. So there are two questions to this poll that's popped up on your screen, and you can answer the first and then scroll down to answer the second. I recognize the categories are general, and in some ways you might have more than one role. If you could just choose the one that most applies to you. Likewise, in terms of siting or the location you work most at, I think that's the intent here. Or it could be where you're at today. I know people traverse between the sites, and some have dual accountabilities at more than one site. So choose whatever you think most aptly fits the description. And we'll just give it to, I think, 1 minute to get everybody's input into this poll. So again, this is now our third poll in these virtual town halls, and it's been helpful to be able to glean this information about who's participating. We can see that there's usually a nice blend of roles across the organization, as well as representation from across various sites. So there we have it. Quick, painless. Thank you very much, everyone, for indulging us in that quick poll. I'll turn things over now to Sharon Pearson, our EVP of Clinical Operations and Chief Operating Officer. Sharon, over to you.
Great. Thank you, Aaron. Good afternoon, everyone. Just a bit of a regular update from me, and I know these are getting to be pretty standard, but do think it's important that we give these updates every week so everyone has this bit of a glimpse of what's happening operationally within HHS. So if we could just go to the next slide, you can see the number of our COVID patients, which is 32 today. I know it says 31 there once the slide goes, but it's 32 with 8 of those patients being in the ICU. In terms of the outbreaks, we have one, and we've had this conversation in previous town halls that we don't anticipate we have seen the end of the outbreaks. It is certainly good news that we only have one right now, but we do anticipate that these outbreaks will carry on as we work through this vaccination and COVID period. The occupancy challenges are unchanged in that they remain high across all of our sites. Really, there's not a site that isn't feeling pressured right now. The contributors to that are the typical contributors in terms of our volumes. We're seeing that resumption of activity. We do have the additional number of patients related to COVID, and in the big scheme of things, it's not a huge number, but it's additional patients in a burden site that we've had historically. And we also have our ongoing ALC pressures as well. The requirements or the expectations as related to our COVID capacity remain. So all of the sites continue to plan for their 15% capacity and as well participate in the census balancing that's happening across the region and the province. And again, we provided you the updated numbers there, and you can see HGH taking 13 in total of the patients that have been transferred in this direction. And if you go to the next slide, from a from an external community perspective, certainly we have seen that reduction, fortunately, in the long-term care homes and the retirement homes. But as you would have seen in the media, we have those challenges now within the shelter and other congregate settings, like the detention center. From our other external facilities, our satellite health facility, if you recall, the intent is to have 90 beds in that facility. We have paused in the opening of our third floor to do some further renovations. But that third floor should be open by the second week of April is what we're tracking. So hopefully we'll be able to be up to fuller occupancy by then. And the Grace Villa, I know we continue to update, but really important is we continue to operate Grace Villa, but those transition plans are progressing well, and we continue to have our leadership on site and working with Grace Villa. The temporary structure that we updated you on last week, and you'd see a bit about this on the hub as well. Some activity there this week. You will see some fencing up now. We still are working on some of the operational details, but no further information to share with you at this point, but we will certainly keep you updated as we can. We do appreciate the parking impact that has been had on a few individuals, and we do apologize for that, and doing everything we can do to mitigate having further impact. So thanks, and I'm happy to take questions through the question and answer. So thank you. Now back to Aaron.
Thanks very much, Sharon. Appreciate it. And now I'll ask Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, to give us an update on the epidemiology we're seeing from the pandemic across the country, the province, and our region. Dominic, where are we at this week?
Yeah, thanks, Aaron. And it seems like I'm repeating myself every week this over the last couple of weeks, which is actually good news. Things remain, at least on the first slide, relatively stable. So Canada is still sitting at 55 per 100,000 per week. Nunavut has climbed up again. You see that Ontario is creeping up slowly but steadily, and I will get to more details there. Manitoba, which had been doing quite well, pushing the numbers down, is in orange now as well, while the other provinces have an RT of below 1, so they are currently trending down. Next slide, please. Now this is Ontario, and as I said, it's creeping up slowly but steadily, and that's what you see when you, as always, disregard the last column here, which is the current week that will be slowly filling up. You see that over the last 3 weeks, every week is a little bit more, but just that little bit. So climbing up from roughly 50 to now 55 per 100,000 per week within the last 7 days. Next slide. Very similar picture again with hospital admissions here from a provincial perspective, hovering around those 700 to 750 hospital admissions across the province, similar to where we had been beginning of December. ICU admissions still higher, not really significantly going down, I would say. Still at the level where we had been end of December, beginning of January from a provincial perspective. Next slide. Now switching to Hamilton, you see more of an increase than at the provincial level, but you also need to see that we had more of a decline when you're looking at week 6 here. I would say the increase has somehow stabilized at the lower level, but it still seems to be creeping up, comparable to where we've been end of November, beginning of December in terms of case numbers. We are now at around 65 per 100,000 per week, so above the provincial average and slightly higher than the last couple of weeks where we were just a little bit higher than 60 per 100,000 per week. Next slide. This is only the community acquired cases, so taking out the outbreak cases, known close contact households, travel, which is very minor anyways, but all of that taken out. And I think last week I said the pattern that we see is very similar to the pattern we saw by end of October, beginning of November. Now it continued to increase, which is sort of a disconnect to what I showed you on the figure before. Main reason being, yes, we do see outbreaks and we see the number of outbreaks increasing, but the size of the outbreaks on average is much, much smaller than what we would have seen back end of November, beginning of December, probably to the large extent thanks to the vaccines in long-term care and retirement homes. So we don't see those large outbreaks in those settings anymore. And this sort of changes the pendulum to more community transmission and less outbreak-related cases compared to when we were sitting in a similar range back end of November, beginning of December. In terms of hospital admissions on the next slide, you can see again, quite stable within the city of Hamilton. We are at around 50 cases, similar to where we've been by mid-December. ICU still higher than where we've been, more comparable to like mid-February in terms of patients in the ICU on a given day on average. Next slide. Now again, showing you the PHAC modeling, and I think you already know the result when we go to the next slide. From a Canadian perspective, next slide please. You see this red line which gets longer and longer and continues to be somewhere between that blue and gray. So it's certainly not even close to the worst case scenarios that they painted. This is the Ontario modeling here. We are pretty much following this purple line so far. We are higher than that actually. We are on average now at 1,200, while they would have predicted maybe around 900 to 1,000 at this point of time. But as you can see here, from March 10 on, there was the first steeper increase, and the next few days will show whether the purple scenario here will be holding true or whether we will be landing more somewhere between the orange and the purple scenario. So fingers crossed that we will not follow the purple line. The longer we can hold around 1,000 to less than 1,500 cases, the better, and the less likely it is that we will end up with the here painted worst case scenario. Next slide. Variants of concern, this is as per yesterday. We are somewhere between 30 and 40% of the positives, screening positive for variants of concern within the province. Hamilton on average, since we are doing this testing, is at 10%, so still below the average. Within the last 7 days, we are at about 50%. So again, lower than the Ontario average. This being said, we now start to see outbreaks with VOC. We had our first one at the Churvinsky, which thankfully was a very small one with just a couple of people involved. But we see more now in the community as well as St. Joe's. So we will continue to learn how to manage those VOCs and how they will compare in our setting to, in terms of outbreaks, compared to the old variants that we had been used to. That's it from my end. Thank you. Happy to take questions, and back to Aaron.
Thanks very much, Dr. Mertz. Next, we'll start our vaccine update. We have a number of presenters today. I'd like to call first Bruce Squires, our Vice President of Women's and Children's Health, to start and kick things off. So Bruce, over to you.
Okay, thanks very much, Aaron. And I'd like to start as Rob did by first off acknowledging really the extraordinary efforts and the great personal sacrifice and professional sacrifice that all of you have made over the past year. and certainly want to thank you for that. And that includes so many of our team who have been working over the last 3 months to do the very best we can to deliver vaccines into not only our own team, but also into the most vulnerable across Hamilton and our region. So when I talk about vaccines, it's clear that really this is about a global scientific and logistical initiative where actions and decisions truly are being made at a number of different levels with a number of different impacts. We think about the national role in vaccines. It certainly is particularly important in terms of the acquisition of supply, but also in providing guidance. We then move to the provincial level. The truth is that vaccines are being treated as a provincial resource, and they've been managed as such. So what that means is that there's some limited capacity for local decision making in that context of a provincial resource with provincial management. That local decision making is ideally in the context of the local circumstances, especially the nature of the population. So where do we stand on the provincial strategy? Well, we're nearing what's been called phase one. Phase one saw us targeting a limited amount of supply according to provincial direction. First at long-term care, retirement home workers, residents, and really residents come first, workers, and essential caregivers. Also targeted at healthcare workers, at adult chronic home care recipients, and beginning in the last little bit at adults over 80 plus. We're now the province is looking to move through the period from April to July into what's being called phase two. And the identified populations in phase two, it starts from an age basis, looking at Ontarians over the age of 60, and really working working downward in 5-year increments. Also targeted at high-risk congregate settings that weren't already covered in phase one. Also beginning to move into Ontarians with chronic conditions and caregivers, and understand that while that is a huge portion of our population, to date the province has indicated there'll be sort of 3 progressive risk movements in those areas, but the guidance and direction as to how that will happen is not yet available, hasn't yet been provided. So we're certainly pushing anxiously for that to come, because that is so important to so many of our teams when we think about our patients, but also our patients and their families, but also our own families. Phase two will also target the wider population, not just on an age basis, but those who are defined as cannot work from home, other, if you like, essential workers in our society, teachers, etc. And there'll also be other high-risk categories to be targeted in phase two. Now, how quickly you move through that is, of course, affected by the state of supply. And you will be hearing lots of press about the fact that our supply is expected to increase significantly in very, very short order. And it's not next week, but in the following week, we're seeing significant growth in Ontario in terms of Pfizer in particular, also Moderna for over what was available. Certainly not yet what we think is needed on an ongoing basis, but there are big jumps. We're also seeing the introduction of the AstraZeneca vaccine in Ontario, and a pilot is being rolled out, or a number of pilots are being rolled out in both pharmacies and in primary care. Those pilots are targeted at Ontarians who are 60 to 64 because of the nature of the AstraZeneca vaccine. And that does include a pilot rolling out in primary care here in Hamilton with the first patients likely vaccinated on Saturday of this week. So if I turn to the city, and I provide this update in the context of my role as co-leading along with 2 city leaders, the planning, operations, and logistics of the Hamilton vaccine rollout, and also as the operational VP responsible for our clinic at HHS. As we look at phase one populations in Hamilton, some good news. We are essentially completed the residents, staff, and essential caregivers associated with long-term care homes and retirement homes across the city. We look at healthcare workers, the groups prioritized at being at the highest risk and very high healthcare workers were nearing completion on that group. What that means is that as of today, we're at approximately 84% of hospital patient-facing workers in the city having been vaccinated, and we should be completely through that group within the next 5 to 7 days. We'll then be moving to the high and moderate group. We've also started since the 1st of March in vaccinating the 85 plus population in Hamilton. And again, by the end of the weekend, starting to near completion in the 80% for that most high risk population. That's been happening primarily through the recently opened St. Joe's West 5th Clinic, and through mobile approach, while of course our HHS clinic has been targeted to healthcare workers from all of the areas. This slide should really be speaking to next week, meaning March 22nd. So week and a bit from now, we'll be ramping up further. So there will be 3 large-scale clinics available in operation in the city of Hamilton. Our own, the one at West 5th, and the city will also be opening a large-scale clinic at First Ontario Centre in the downtown area. As well, mobile clinics will continue. And again, that is possible with a bump of supply the week of March 22nd. Those channels will be used to continue to complete phase 1, including moving to the next age band of 80 to 84. And then as we progress over the coming weeks to move into the phase 2 populations. So with that, I'll turn it now over to my colleague Les Gauthier to provide a little bit more detail on our clinics.
So thank you and good morning. If I pause for a second and reflect a year ago March, as we were learning about the pandemic being declared, many people said, hang on, that you're about to enter a marathon race and that this was not going to be something that would be managed and over by the spring or by the summer, but it would be minimally a year-long marathon. I don't think many of us at the table at the time thought at a year we would have as many of our frontline teams vaccinated as we get to celebrate this morning. And as I say that, we all acknowledge it's been a little bumpy dependent upon supply chain. But I actually think, and I'm just building on Bruce's comment, tremendous work of people who have come together to help put needles in arms. And we should pause this morning and celebrate the success of that and appreciating there's feedback with it. The clinic has actually done an amazing job. So in terms of the update, important that people understand we have been given provincial direction that the timing of second doses is now out 16 weeks or 112 days. There's soft bumpers around that. It's give or take a few days, but essentially anyone who as of, oh, she's moved me to the second slide. Anyone who as of March the 10th has not had their second dose are going to be scheduled 16 weeks out. Anyone who is getting a first dose after March the 10th will be scheduled at 16 weeks out. And then the important thing again is the clinic's going to contact you. They'll reach out to reschedule your vaccine. It's a really important message and provincial decision is the goal is to get as many people as possible with first doses in arms, as opposed to ensuring first and second were done for half the numbers. I'm sorry, Leslie, can you flip me back to the first slide? Just for a second. These are the numbers that Bruce was referencing, and I just want to make sure people kind of see them in black and white. So as of March the 10th, which was yesterday, we're looking at almost 12,000 of St. Joe's and HHS healthcare workers who were vaccinated. Bruce shared the celebration. Of those people who have registered, 84% have had their first dose or are scheduled to be vaccinated in the upcoming days. So the clinic has capacity between 1,000, 1,200 first doses daily. And the thing that I wanted to go back just to make sure, booking that amount of people has taken tremendous HHS teamwork, and sincere thanks to many people who I'm sure are listening that either helped identify some frontline teams who could help us schedule, or you yourselves have been making the phone calls to help schedule people. So just want to celebrate as a second celebration, all those people who have been scheduling people into the clinic. And the last slide is Les's standing transition of the vaccine update into the important work of the PPE task force. So not even a gentle reminder, a very strong message that people need to remember. Just because you've been vaccinated dose 1 or dose 2 does not mean we should be letting up on our PPE practices, making sure that we are continuing to maintain distancing, and all of the other work that we described last week in the hierarchy around screening of people, staying home if you're unwell. So really important that that is a first principle we all come to work with to remember. The second is around the phone calls. So again, 9 to 9 is the range people are calling out. Lucas is joining us this morning on the call, and they've done a tremendous amount of work with our communications people. If the call is made from the clinic, you'll now see it on your phone as the vaccine clinic. If the call is made from people who are volunteering or working from home, you still see that unidentified caller. So could be either or, just super important. If you're in the 16% of the first 2 groups to be booked, remember to answer your call if at all possible. The third bullet is, as we are working to get needles in arms, there is a daily call out for a standby list. It's good for today and we start over tomorrow. And that is to ensure we're not wasting any doses, all the residual doses and capacity that we are out providing vaccines to our forward-facing patients. And then the last bullet here is, again, a reminder, if you have any personal health information, you need to seek clarification around the appropriateness or vaccine hesitancy. Those are conversations you should be having with your personal healthcare team before you come to the clinic. With that, I'm going to turn it over to our colleague Fiona Smale, who's going to address the provincial decisions around the second dose timing. Thank you.
Thank you very much, Liz. So I really understand the concern and disappointment that many of us feel because of this delay. I think we could see the light at the end of the tunnel, and now it's been pushed back a little bit further. The rationale for this, I think everybody does understand, but it's still hard personally to take it. So do understand that I think we're all feeling this same challenge at the moment. The memo that we received from the Chief Medical Officer in Ontario really provided some data in terms of supporting this decision for stretching out the second dose to 4 months. The real world experience with both the Pfizer, Moderna, and now the AstraZeneca vaccines do indicate high vaccine effectiveness against symptomatic disease, hospitalizations and death for at least 2 months, and in fact it's probably longer. And based on immunological principles and vaccine science, this short-term protection is not likely to wane rapidly, and nor is there a delay expected to result in any reduction in the final immune response. The challenge that we all have is that that final immune response is being pushed out, and that's where I think we're feeling disappointment and quite uncomfortable. The decision was made, as I mentioned last week, following NACI, the National Advisory Committee on Immunisation, recommending that it could be extended for up to 4 months when the supply is limited. And we know that the supply is limited, although improving really every day, every week. And more people will be protected, and the overall population immunity to COVID will increase sooner if we can roll this out to more people. Within a global pandemic, reducing the risk of severe disease outcomes of the population really is our primary public health impact and where we're going to get the greatest benefit. And so that's why the decision has been made. We do anticipate that everyone who's eligible will be able to receive their second dose within that 4-month recommended period. And really, I know there's been a lot of discussion about comparing the vaccines, but any of the 3 licensed vaccines are safe and effective. And while we're seeing some differences in the efficacy reported from randomized trials, which have led to some uncertainty as to which is the best vaccine, all are expected to be effective at the community level in controlling COVID-19. And so, as I've mentioned, this decision will cause concerns and worry amongst our teams. We're hearing this, and please reach out. The resilience resources are available on the website. Look for help if you are feeling that this is just that final thing that you really need support with. Thank you very much.
Thank you very much, Dr. Smale. Okay, so now I think we've come to the end of our presentation, so we have time for Q&A. I see some questions have already come in through the question and answer feature. You can continue to use that to post questions as we take on this part of our agenda. You can also pose questions to panelists directly by raising your hand in the participants function. So if you, as an attendee today, down there in the participants box, raise your hand, you'll be able to ask a question when we call on you. So the first question, maybe Bruce, you could provide some insight on this, is around who's administering the AstraZeneca vaccine right now? Has the province announced who will be delivering that vaccine specifically?
Yeah, thanks very much, Aaron. The province's current plan as it relates to the AstraZeneca vaccine is to use pharmacies and primary care offices for administration. And as I mentioned, they're going to start out targeting the 60 to 64-year-old population through those 2 channels. It's happening in pilot, so there's, I think, 50 or 60 pharmacies across the province, and there are 4 or 5 sites or 4 or 5 cities where there's a primary care pilot, including Hamilton this weekend, starting a primary care pilot. In all likelihood, that will continue to be the channel by which the AstraZeneca vaccine is distributed. You want me to? I could maybe take a couple more here, Aaron, if you like, while
okay, Bruce, we'll do a rapid round with Bruce.
Yeah, rapid round. In terms of empty vaccine appointment slots on a daily basis, none of that vaccine is going to waste. We're using our standby list to ensure that we don't have any doses wasted, and anything that isn't used then carries over to the next day. As it relates to the interval, the move of the second dose interval out to 16 weeks, to date, the province has provided some permission around a window there so that it doesn't have to be exactly on the 16-week anniversary. To date, that window has been plus or minus 4 or 5 days. So not moving up to 14 weeks, but with a little bit of spacing around that 16-week date. And in terms of second doses, absolutely the intention, the understanding is that second dose will be matched with first dose, and so far planning has allowed that.
Bruce, there was a question in there too about, as we proceed, would we use any unmet appointments? You know how you have the sort of unfilled spots in the day to deliver second doses, or will we continue to proceed to use those unfilled spots for first doses?
Yeah, the provincial direction for sure is that that unused spots should be, or residual doses should go to the first dose population that has been targeted, and that we're not to move outside of the second dose direction.
I see. Leslie, I see you come on camera. Did you want to add to that?
No, I'm good.
Nope. Don't come on camera. I'll call you out.
Okay.
Maybe also, just while we're on the topic, maybe Dr. Smale, you can provide some insight on the AstraZeneca vaccine. Specifically, there was some scuttlebutt in the press today about certain European nations pausing use of that vaccine for a variety of reasons. Can you help us understand what's happening there?
Well, I think whenever you roll out a vaccine, there are going to be adverse events occurring, but is the adverse event associated with the vaccine, caused by the vaccine, or is this just the normal background rate of any condition? And it's blood clots that have been particularly raised at the moment. So what I would say is there's very intense post-vaccination monitoring going on. We're going to find these types of things, but just because it's been identified doesn't mean that it's caused by it. And until we've got a better sense of the whole population risk, I think we just have to be aware of it and wait for better data. As I say, there's always going to be a background rate of any complication that will be identified in people receiving a vaccine, but that doesn't mean that it caused it.
And while I have you on camera, a couple other questions about the science here. I know this question has come up before, but can you give us a sense again of what's the distinction between the efficacy of someone who's had just the first dose and then the efficacy of the vaccination once you've had 2 doses? Like, is there a big gap there?
The gap seems to be getting smaller and smaller as time goes on. Initially, we were looking at somewhere in the range of even 90% with that first dose, based on the earliest data from the randomized studies. And I think that overall, we are looking at about a 80 to 90% efficacy rate from that first dose. But the data are still being accumulated, and particularly from the UK, where they have actually had this 12-week interval really from the beginning. I think we're all keeping a very close eye on their data to be able to inform us more confidently what the absolute effectiveness is. I think what is going to be important is that after that 1 dose, we really can't assume that we can really let our guard down. And so this is going to be, I think, both within our hospitals and our communities, a reason why we still need to maintain the physical distancing and the PPE.
There's a question here I want to ask you. I think you more than most is probably well suited to this question. As this, we have these changes in protocols, evolving science. Certainly there's some people who are skeptical, hesitant about the vaccine. The question is, what could you tactfully say to someone that who is adamantly against the vaccine? I mean, people will have different reasons for that, but is there a sort of a general frame of answer that you would recommend?
Well, I think actually it's always important to ask the person what the reason is, because sometimes it's hard to address the concerns without having a sense. Is it the safety of the vaccine? Is it the efficacy of it? Is it the uncertainty about the long-term data we've got? So address each one of those concerns and sort of more focusing on what that individual person's concerns actually are.
Yeah, okay, thank you for that. Leslie or Bruce, maybe there's a couple of process-related questions here about, again, vaccine scheduling. So if the recommendation is up to 16 weeks now, how do we account for that in our scheduling processes? Do we try to get people booked in ahead of that 16-week deadline to make sure they get it within the time period? What's our practice right now?
Yeah, so just to maybe even a little bit more on that, Aaron. So anyone who had a scheduled second dose will receive by email, text notification that that appointment will be rebooked, and then will receive email confirmation of the rescheduled appointment. The rescheduling of those appointments will be at approximately 16 weeks from the time from first dose, but with a plus or minus. And really on the plus side, 3 or 4 days as necessary. That's what's been provided by through the provincial guidance. So if you haven't gotten an email yet, one would be coming. We'll continue to communicate on that, and then there will be a mechanism for confirmation of your second appointment. In terms of exceptions, because there is a question to that, Aaron, I want to make sure to answer that. To date, the exceptions to the second dose interval under the direction from the Chief Medical Officer of Health in Ontario is for residents of long-term care and retirement homes, for First Nations Indigenous populations in their community. And there is expected to be some further guidance as it relates to urban Indigenous populations. To date, there are no other specific exemptions provided to the extension of the second dose interval.
There's a question here too about again, I know we've tackled this in the past, but just in case someone on the line didn't know the answer, if you received the Pfizer vaccine as your first dose, is there any likelihood that you would get a second dose of a different vaccine?
No, that's at this point seems quite unlikely, Aaron. Obviously, there are no guarantees in this world of global vaccine supply chain, and the possibility of interruption or disruption. But to date, every indication would be, and certainly that is the preferred approach, is that the second dose matches the first dose.
So as this is sequencing with the prioritization on first dose as much as possible, right? That's the goal right now. Is it possible that we would see some people with perhaps administrative jobs getting their first dose before someone in a clinical facing role would be getting their second? How's the staging look, and is that at all possible?
So employees, staff, and physicians of the hospital under the provincial guidance are defined as healthcare workers and are prioritized actually in phase 1, but on the moderate risk level. So while that group hasn't been vaccinated yet, it's identified under the provincial direction and staging to be a priority population. So we would expect that that group of employees would receive vaccination at some point, if not at the very earliest in stage 2 or phase 2, it would be during phase 2. And so that would certainly be prior to the 4-month interval for others that are receiving their vaccine right now.
Leslie, you had your hand up to add to something here. Can you go ahead?
Yeah, just to clarify, there are frontline managers who are truly frontline in interacting with patients and families and teams, and especially our high-risk teams, and they are included in that very high priority group. So that's a decision-making. For sure, administrative roles that are working from home or not on the clinical areas are, as Bruce referred to, in the moderate group, but there equally is a group of frontline leaders who are included in that very high priority group. So you could be sitting next to a manager getting a vaccine.
Gotcha. Okay. And maybe Dr. Smale, I know we talked a little bit earlier about the efficacy of the vaccine. Like for somebody that's gotten the first dose and you have a window of protection, is the sort of 16 weeks we're now waiting for second dose, is that, do you get a diminishing rate of return on that protection in that window, or Should people be more guarded as time goes on in terms of the prevention measures they're taking?
I wish I knew the answer to that question. It's a difficult one. I think our recommendation is going to be maintain your physical distancing and your PPE for that interval. What does concern me is that people are going to start to let their guard down. We've been at this for a long time, but at this point, we are confident that the level of immunity we're going to get fairly widely will prevent the hospitalizations, people getting sick and dying. And that, I think, has to be our focus over this next 4 months.
Gotcha. Okay. Well, I think we've managed through a number of questions today. Thank you to everybody. I know there's still a couple standing in the Q&A that some we have answered in some ways, others still deserve an answer. So we'll do the very best that we can to get that posted to the hub, or send an answer to someone directly, or use that question to inform content at next week's town hall. But I want to move us to our celebrations now. You can type in a celebration in the chat forum, and I'll read it out loud. Our CEO, Rob McIsaac, who normally reads out celebrations with me, had to join another regional planning meeting a little earlier. So he's not here now, but I'll do my best to handle this on my own, and welcome anyone else from the panelist team who wants to jump in for sure. So you can either type your shout out into the chat forum, or you can raise your hand as a panelist or an attendee, and we'll call on you to read your shout out live. Certainly, as we think about March 11th today and all that's been said, there is much that we've been challenged by, but much to be grateful for as well. So we see from Sandra Lloyd, congratulations to Janie Lucas, 40 years with HHS on March 26th. I often affectionately refer to Janie as coach because she's my CQI coach. So congratulations, coach. 40 years, that's a hell of a milestone. I see Leslie Gauthier with your hand up. Go ahead, Leslie.
I'm back on camera. So I just wanted to do a big shout out to our diagnostic imaging team. And people may or may not realize, but especially the teams who are working in CT and MR, across our LHIN, they have all been challenged to work incremental hours, weekends, work the night shift to really try and address some of our patients who have been waiting for imaging, especially CT and MR. The team's done an awesome job. They really have made a difference to try and catch up on some of those patients waiting. But we know it has really impacted their work-life balance with home. So sincere thank you for all those patients you've helped.
Wonderful. Thanks for that, Leslie. So again, you can raise your hand and we'll call on you to give a congratulations, a shout out, a recognition live, or you can type something in the chat forum and we'll read it out. Bruce, I see you've popped up on camera. What would you like to say?
Thanks very much, Aaron. Two from me. One to celebrate the appointment of Dr. Stelios Georgiadis as the inaugural, that's a tough word, McMaster Children's Hospital Chair in Autism and Neurodevelopment. That's just an amazing step forward for our research and our clinical activity here in Hamilton and at the Children's Hospital, in a recognition of his international leadership in relation to autism and autism research. And the second for me, real quick, is to acknowledge the upcoming, within the next week, retirement of Lori Eisenman after 30 plus years, including the last few as the director of mental health and child and youth mental health and autism. Lori has been a remarkable leader of really the quality of care here at Hamilton and the support to children, youth, and their families dealing with mental health and autism. So big thank you to Lori.
Yeah, those are two great, nice passages in the same program area. So thanks for pointing those out. I see here too from Stephen, congratulations to the physiotherapists at the Regional Rehabilitation Center who've been recognized by the School of Rehabilitation Science at McMaster for their contributions to the school. So way to go. Thank you for posting that, Stephen. I see here also from Sharon Pearson, Janie, again, to Janie Lucas, congratulations, 4 decades, so much time and so many contributions, amazing. Thank you for pointing that out, Sharon. Okay, I think we're slowing down. So we'll call it there. Perhaps thank you everyone for making time for this town hall today and for all that you've accomplished and sacrificed so courageously during the last year. We're not done yet and there's more to go. We'll keep holding these town halls weekly as a way to keep connected on what's happening with the pandemic. So until next time, stay safe and we'll see you soon.